Is India equipped to handle the new coronavirus? The novel coronavirus is spreading at a rapid rate and leaving millions of people around the world worried about their safety. According to the latest data, it has affected 2,700 people in China and around 80 have succumbed to it, which many global health experts feel may be a restricted figure shared by the Chinese authorities. As per World Health Organization (WHO), symptoms of coronavirus include fever, cough, shortness of breath and breathing difficulties. At its worst, it can even lead to pneumonia, SARS, severe acute respiratory syndrome, failure of kidney and even turn fatal. A recent statement by a Chinese official has raised growing concerns. People who are asymptomatic, not showing symptoms, can also infect others. This makes it all the more difficult to control it. We spoke to Dr. K.K. Agarwal, President, Heart Care Foundation of India (HCFI) and Confederation of Medical Associations of Asia and Oceania (CMAAO) about the virus. All countries are susceptible to new strains because their populations do not have immunity against them. It will enter India and India is not adequately equipped to identify individuals who carry the disease at entry ports. Besides, the diagnosis of coronavirus remains a challenge as the initial symptoms resemble those of common cold or respiratory diseases. We need to diagnose the first case and not allow it to spread to others. For this, multiple ministry coordination is required. As this strain is a novel coronavirus 2019 nCoV, no individual is immune to its infection. Thus, its entry and spread into India must be prevented. The Indian government has reached out to the WHO to understand whether India needs to take any precautionary measures to prevent the entry of this novel virus that causes deadly respiratory disease. The WHO recommends the prevention of viral spread through regular washing of hands, covering the mouth and nose while sneezing and thoroughly cooking meat and eggs. All authorities, including the National Health Authority, the Ministry of Health and Family Welfare and the National Health Portal must join hands and act in unison to spread public awareness about this novel virus and symptoms of infection for the early identification of its occurrence and prevention of spread. Stringent quarantine measures and accurate diagnostic techniques must be employed for appropriate diagnosis, contact tracing, isolation and treatment of patients and to prevent mortality. Experts are not too sure how travel restrictions will really help. And whether the measures taken by global authorities will work in containing the virus remains a matter of debate.